Well, as the world marks the 20th anniversary or the 20th edition of the African Traditional Medicine Day today, there are increasing calls for these health treatments to be brought into the mainstream medicine arena. 80% of Africa's population are said to rely on traditional medicine for their basic healthcare needs, yet it's mostly overlooked by Western-orientated knowledge systems. Now, the University of the Free State's Pharmacology department has made many strides in research and says this shows they could offer a solution to Africa and the world's health emergencies. For more now, I'm joined by Professor and Director of Pharmacology at UFS, Professor Motlalepula Matsabisa. Prof, thank you so much for your time this evening. As always, a very exciting developments happening at your department. Before we talk more generally about this important day being marked, a news coming through that your department has received a 58 million rand grant from government and is busy establishing one of the most advanced research and development pharmacology laboratories in the country. And I'm assuming that would also make it one of the most advanced on the continent. This is very exciting times because you write in a piece that's been quite widely read to mark this day, that there needs to be more of an acknowledgement of the role of African traditional medicine. Now, receiving a grant like this surely is a step in the right direction.
Good evening, Marcel. Thank you so much. Yes, indeed. We did receive such a grant to build really one of the most advanced research laboratories that is accredited, for GLP, but also as a process towards building up an industry to address the aspects of local manufacturing of well-researched quality traditional medicines. The laboratory will be, I think, one of its kind. It will be one of the best in the region, probably, yes, one of the best in the continent, where we want to build and research, traditional medicines products so that we can then give, I think, those products to the patients, and patients can have confidence that these products are safe, they are of good quality, and they're effective. So that's really the purpose, to address the local manufacturing of herbal medicines.
Now, during the pandemic and during this battle which is ongoing against COVID-19 and all the other coronaviruses that we know are out there, traditional medicine really held its own. And anecdotally, you heard people talking about using what would be deemed a traditional medicine, people in urban areas, people who don't come from that kind of background. What would you say is the impact that COVID-19, our experience with it, has had on raising the profile of African traditional medicine?
COVID-19 exposed Africa, I think, as a whole, and exposed Africa and its leadership in terms of preparedness, in terms of being resilient, to disturbances that would come on the continent, in terms of aspects of health, in terms of, I think, economic shocks that we were not prepared as a continent. We did not have our own solution. And the reliance, I think, from outside, I think partners showed us that, in fact, you can be on your own while you still have partners, and you can still be on your own if you're not prepared. So we realized that, I think, the best we could do would be then to look at the bioresources that we have, and see if we can build therapeutics and develop therapeutics that would then address, I think, the aspects of health, that would also address, I think, the issue of the pandemic, and be prepared, I think, for the coming pandemics.
What would you say, as we mark this important day, African Traditional Medicine Day, is the biggest holdback for traditional medicine to be seen on a par with Western medicine? Is it marketing? Is it packaging? Is it that you can't walk into a Clicks and see it on the shelf, or that you don't go into what we see as a traditional or accepted surgery and see a doctor who then writes you a script to go and get it at the pharmacy? What is the biggest holdback, do you think, in traditional medicine really taking that step up of being seen on a par with Western medicine?
The greatest challenge I think that we have, over and above the aspect of equity in terms of research funding for traditional medicine, it is that it is just being tolerated. It is not fully institutionalized so that then we can have an integrated health systems, I think, in our countries where patients then could have choices to say, this is the form of the treatment that we want then, I think, to use. And now I think, what COVID did showed us, I think, that we have such a gap. But also the greatest, I think, challenge has then been that most of the products were not, I think, well researched. There were no, I think, funding, to do research. The research that could have been done was at the preclinical, I think, level, which means they were just at the laboratory, I think, level. And that was not enough, to bring these products onto the market. And the last greatest challenge is the regulatory framework where we need to register these products so that they become available, I think, onto our hospitals, they become available onto our clinics, and our own governments buy them as part of the essential medicines list. So we need to have some traditional medicines that we could then say these have been listed as essential medicines, in the country. But I think, with what we are doing at the University of the Free State, thanks, I think, with the support from the Department of Science and Innovation, thanks with the support from the Technology Innovation Agency, who supported us with that money to say, let us now focus on building, I think, this industry. And this industry can then only be built, with backing from good science and good research. And so that then the skeptics, who are out there could then look at it and say, indeed, the science that was done, it is good. And the consumers and the patients then begin to have confidence in the products.
Do we need to talk about the power of the big old pharmaceutical companies? Because ironically, I mean, these are companies that have raided the natural resources of South America, of Africa, and the knowledge, obviously, of the traditional peoples as well, that so much of that is at the core of so many pharmaceutical products that we see out there, that they have been able to benefit. Do you believe that the power of the big pharmaceutical companies is something that you need to concern yourself with? Or are you happy just to say, look, that's always just going to be an issue. They're going to be powerful. They're going to have all the money in the world. We just want to focus on getting the research right and ensuring that African traditional medicine is finally given the respect that it deserves.
No, Marcel. I think what we need to do, I think we cannot be comfortable, when the status quo is not right. So we need to go out there and disrupt, I think, those, economic instabilities. We cannot then sit and say, yes, because the pharmaceutical industry is so powerful, and therefore let's take away the right and the choice of patients, for the treatment, options that's available there for them. The world in general is moving towards natural medicine. And we have the most resources, we have the raw materials, I think, in this continent. And therefore, we need to take charge ourselves to say, let us develop products that people want. Let us develop products people have confidence in. Let us develop products that people believe in them. And this we also believe, I think, I must say this. We've been talking about universal health coverage, and say, what is this universal health coverage that we are talking about, and how could traditional medicine contribute in that? In the simplest way, it's universal health coverage is access. We need to have access to services of health, and these services must be of sufficient quality, they must be effective, and while we are doing that, they must ensure that the services do not, in fact, disrupt the finances of the people. So therefore, traditional medicines could be affordable, could be accessible, and it actually could be preferred by the people. After COVID, we started then talking about health resilience, to say, I think, we have learned, as a continent that we were not prepared. And now we're saying, in fact, that health resilience, can actually be addressed by traditional medicines, because health resilience says, how could we be prepared, for the shocks in health, for the shocks in the economy, and for the shocks due to the pandemics. We were not prepared. But right now, I think we're better prepared because we know that traditional medicines can contribute. And we should take, I think, that responsibility as Africans to develop our own industry. And that's why we're beginning to talk about how do we begin to fast track the local manufacturing, of herbal medicines. And that's why we are building up these laboratories to be better prepared, to then have this health resilience that we're talking about, but also then to have the universal health coverage where traditional medicines can contribute.
There's so much more that we can talk about. This is a very important topic, but I'm sure we'll get an opportunity to do it again in the future. Thank you so much for your time this evening. Professor and Director of Pharmacology at the University of the Free State. That's Professor Motlalepula Matsabisa joining us there virtually. We thank him for his time and for the very important work that he and his team continue